Hello friends, welcome to my YouTube channel Kavita Nursing Notes, and this is the second part of angina pectoris. In first part we have seen that angina is a severe form of chest pain that is called strangling chest pain. Due to the insufficient flow of blood through the blocked coronary arteries, the heart muscles are not able to get enough oxygen and nutrition, due to which patient feel a severe form of squeezing tightness chest pain. So in first part we have seen the types of angina pectoris and its causes and pathophysiology. So let's start the second part. In second part we are going to see signs and symptoms of angina pectoris. Okay, the first sign in angina pectoris is pain. This pain is so severe pain, and it relieves a discomfort in the chest of the patient, and this pain is very squeezing type of pain which happens in the chest, which is full of pressure, heaviness, tightness, burning, and usually this pain happens behind the breastbone. We can say that this type of pain is very severe, which happen at the back of sternum region. Okay, and in this pain patient will feel a dizziness, a light-headed dizziness with a fatigue in his body, because the heart muscles and the body cells are deprived of oxygen supply. This pain is can radiate to the left arm mainly. So this pain is a radiating form of pain which can radiate to the jaws, to the arm, shoulder, neck, and upper abdomen or back. So this is a radiating type of pain which is happen mainly to the left side of the patient, but in several cases it could be seen in the right side of the patient. Okay, next is indigestion. Due to the low oxygen level in the blood, the patient metabolism process is slow. The metabolic substance, the food, is not able to digest it properly, and there is a nausea and vomiting the patient feel. A cramping severe pain is felt. Sometimes patient feel that this pain is due to the acidity or gas formation, but don't ignore this sign, just go for the checkups. And patient feel a shortness of breath due to the dyspnea formation. There is a short of breath due to low oxygen level, and a choking sensation could be feel. Heavy sensation in the upper region of the chest, as it is seen that the angina pains happens above the umbilical region of the patient, mainly in the abdomen and at the back. Patient feel a fainting, feeling of fainting, and a dyspnea feeling. And the patient could also feel a low energy level and a very severe form of chest pain. Other signs and symptoms which you can include in angina pectoris: low oxygen supply leads to the weakness, tiredness, and a severe feeling of low fatigue level. Come to the diagnosis of angina pectoris. In first we can do the electrocardiogram. Electrocardiogram, we can say it is ECG or EKG. The electrical activity of the heart is measured in the graphical form of the trace paper, and the several electrodes lead are placed into the chest of patient, by which electrical activity, its rate, rhythm are noticed. In history collection, we can ask the patient that in his family did anyone is having a heart problem or not, because it could be transferred to the next generation. And in physical examination we ask about the daily routine of patient, and does he feel any nausea, arrhythmia, or anxiety type of feeling or not. Angiography. Angio means the graphical representation. It reveals with the arteries affected. In angiography we see the coronary artery, and how this graphical diagnosis is done. We place a thin wire guide tube through the groin area of the patient, and these wire are placed into the coronary artery, and where there is blockage, the arteries are not able to show it in the X-ray. The clot formation or blockage is shown in the X-ray. Okay, so it is a graphical form where we can present with a guide wire that where is the blockage in the coronary artery. Blood test. Why we do the blood test? Because when there is a heart attack or myocardial infarction comes, then the heart release a troponin enzyme in the blood, and it dissolves in the blood, which could be tested and which could show that there is a damage in the heart muscles, or it could be done to measure the level of cholesterol, fats, diabetes and proteins level in the blood. Echocardiogram. Echo means sound waves. Through the sound waves we measure the heart rate. It's is it a high rate or is it low rate, means patient is feeling arrhythmia formation or not, and how the heart electrical activities are working, how is this SA node and AV node are working, his valve are working or not properly. Chest X-ray. Through chest X-ray we can see other organs too, like the like our lungs and our stomach and other deep organs. So chest X-ray can also be done in the heart disease. MRI scanning. MRI means magnetic resonance imaging. Through this imaging, a high resonating wave or high resonating images are noticed of the heart. And CT scan. CT means computerized tomography scan, which is a form of a scan in which we can also place a dye to see the chambers and how the blood is flowing through the heart arteries, mainly through the coronary artery, and how the heart chambers are working properly or not. Next come the position emission tomography scanning. Position means a electrolyte tracer substance, a radioactive tracer substance is injected into the patient coronary artery, and where the tracer is not able to reach up to the coronary artery, it means there is some artery get blocked. Okay, so through our tracing through a nuclear substance we notice that there is a blockage in the coronary artery. And through the Holter monitor are placed into those patients whose electrical activity are not able to noticed within a period, okay, within a short period. So we place a ambulatory type of machine into the patient chest, and for 24 hours for a day we can notice how the heart electrical activities are functioning. Means for 24 hours we ambulate the patient with the Holter monitor, and we can notice his electrical activity in 24 hours. So next comes with the medical management. How you treat the patient through the medicine who have angina pectoris. Firstly, we will give coronary vasodilator. Coronary means the medicines which could dilate the blood vessels, mainly which vessels? Coronary blood vessels. So in this we can give the tablet NTG, that is called nitroglycerin tablet, and this tablet is given mainly through the sublingual route under the tongue. Okay, so this is sublingual medicine. Next we give beta blockers. Blockers means these medicines block the supply of epinephrine, or we can call it as a adrenaline hormone, because these hormone used to contract the blood vessels, and if the blood vessels will get contract, then the blood supply will not reach up to the heart. So we give beta blockers. These blockers will block the effect of epinephrine or adrenaline hormone. So in this we give the medicines atenolol and propranolol and metoprolol. Next comes the calcium channel blockers. Calcium means the calcium, these medicines blocking the calcium, because the calcium get influx into the cells. Which cells? In the coronary artery cells and in the heart muscle cell. So what they are doing while they are influxing into the cells, if the calcium will get influx into the cells, then they will contract that cell, they will contract the artery. So calcium channel blockers we are giving to block the calcium from going inside the cell, from influxing inside the cell. Example tablets nifedipine and amlodipine. Next we give anticoagulant and antiplatelets tablets. Anticoagulant means coagulation, accumulation, okay, accumulation, coagulation. These tablets are blocking the platelets aggregation, platelets clot formation. So in this we give the tablet aspirin, heparin and clopidogrel. Next come the cholesterol lowering agents. We give the cholesterol lowering agents which could lower our bad cholesterol level, mainly our triglyceride, our LDL, low density lipoproteins level. They block the enzyme which help in the formation of cholesterol, and these tablets also help in the release of atherosclerotic plaque formation by extracting the lipids and fat which get deposit into the coronary arteries. Sometimes this tablet helps in the extracting of fats, lipid and this deposition from the coronary artery. In this we can give the tablet statins. Okay, statins. Next comes our surgical management. So in surgical management, first surgery is our coronary artery bypass grafting. Grafting means a graft. Graft means something is removed from any place and it is attached to other place, that is called grafting. Okay, so in this procedure what we do, we take a artery or a vein from our own body. Okay, so suppose this is a way to of a blood flow to the heart. Okay, this is our coronary artery and there is a blockage. So this way is totally blocked. There is a clot formation, there is atherosclerosis formation. The blood is not able to reach up to the heart. So other way is formed. Through other way the blood will reach up to the heart muscles. So bypass means we are changing the way up to the heart. We are changing the way of blood supply up to the heart. So this graft is taken from our own body, like from groin area, right from wrist area, the vein or artery. Next comes the atherectomy. Atherectomy means opening. It is an invasive procedure in which the coronary arteries are open and this blocked is removed. Mainly this procedure is done in those type of atherosclerosis in which there is a hard plaque or atherosclerotic deposition happens. Okay, so when the plaque is not able to remove, we do the atherectomy procedure. In this process, several type of instruments are used, like in rotational instrument. In rotational instrument, this cutter will cut the plaque which is deposited into the both side of the coronary artery. So it is into rotational form, or this could be done into a singular cutter form which could remove this plaque atherosclerotic formation in a single cutter form, or it is done through the laser formation or through the burning formation which can burn the clot. Next come coronary stent. Coronary stent is same like as we do angiography. A graft is placed up to the coronary artery, and where there is a blockage we used to place a stent there, and the stent will, a mesh coil stent will press this blocked fat and lipids deposition, by which a blood could properly flow up to the heart. PTCA. PTCA means percutaneous transluminal coronary angioplasty. In this procedure, it is a invasive procedure in which a thin wire tube is placed from the groin region up to the coronary artery, and where there is a deposition of a plaque, we place a wire catheter, and with wire catheter we placed a balloon. This balloon is inflated. Several times this balloon is inflated so that these deposition get pressed to the arterial wall. Okay, so when this deposition get pressed completely up to the arterial wall or up to the mark up to the arterial wall, then a mesh stent or any coil stent is placed up to there, and by which a blood could flow. Okay, so oxygen therapy. Why we need oxygen therapy? Because it happens due to the deprivation of oxygen up to the myocardial cell, so we supply oxygen to the patient. So next comes to the nursing management. So in nursing management, firstly we will teach the patient that he will quit the smoking. Okay, all the bad habit like alcohol, smoking and tobacco, it could irritate the coronary arteries wall and they get break. Okay, so maintain a healthy lifestyle for the heart healthy, like balanced diet or doing a regular exercise or 30-minute walk every day in a week. Means 5 days we can do in a week, it's enough. Okay, so regular brisk walking is important. Then nitroglycerin is administered sublingually and the patient response is assessed how he is feeling. The pain gets subside or not by giving the nitroglycerin tablet to the patient. Administer oxygen. If the patient is feeling deprived of oxygen, he is feeling shortness of breath or dyspnea, then we can administer the oxygen supply to the patient. Okay, if the patient is still feeling chest pain after giving, you have administered the nitroglycerin, then it is given after some 5 or 10 minutes up to 3 times. Okay, doses up to 3 times by by asking your physician or doctor. So each time while you are administering the nitroglycerin to that patient, the time, BP, heart rate, its ST segment changes are assessed. Okay, so you should be precautious while you are giving nitroglycerin tablet to the patient. Instruct the patient regarding low calorie. Okay, low calorie diet is important for the healthy heart. So in low calorie diet you can have balanced diet or can have a lot of fibers in your diet, reduce the fat supply in your diet, and low sodium is important because sodium increases the blood pressure and blood pressure create a wall damage. Okay, so low cholesterol, low fat diet are instructed to the patient. So thank you so much, friends.